So let's go ahead and move on to our 6.2 item at 9:06 a.m. Consideration of update on COVID-19. And Dr. Bloom, the floor is yours. Good morning.
Good morning. I'd like to say good morning to the chair and to the supervisors. And again, just want to introduce myself. My name is Evan Bloom, and I am taking over the acting public health officer position for Dr. Pace this morning as he is on vacation. And I wanted to update you on the COVID response in Lake County. So just an overview of how I'm going to approach this. I'm first going to talk a little bit about how the cases are doing, go over the tier status that we're in, and then talk about our vaccination status. And then I'm going to hand it over to Sarah, our epidemiologist, to talk about our current data points from this past week, and then just talk a little bit more in detail about the various categories and subjects that Sarah discusses. So without further ado, how are our cases doing? Actually, overall, our cases are doing quite well. I'm happy to report that they continue on a downward trajectory. And although there are still viral variants circulating in the county, certainly as was previously discussed by Dr. Pace, it appears that the immunity that is derived from the vaccines that have been administered still holds against these variants, and that the only cases that we are currently seeing that are positive COVID cases are in those who are not fully vaccinated. This obviously gives credence to what we have been doing, and even more credence to why we want to still go full bore in our efforts to vaccinate all residents of the county. As far as our tier, we are still in the red tier. However, as our metrics have been improving and have stayed improved over the past 2 weeks, and the state has delivered its 4 million vaccination doses, which changes the metrics of when we move tiers, I fully expect that tomorrow we will be moving into the orange tier, which means a loosening of a number of different restrictions placed on businesses and activities in the county, which I will talk a little bit more in detail about later. As far as the vaccination status goes, as Dr. Pace mentioned previously, we still have a vaccine surplus, and the goal still remains, as I just mentioned, that based on the science, to give vaccine to every willing arm in the county, as this is the best way forward to protect our residents of Lake County against COVID-19. And that being said, unless there's any other objection or questions at this time, I'd like to go to Sarah, our epidemiologist, for a further delving into the current data.
Dr. Bloom, good morning, everyone.
Good morning.
Okay. Is my screen loading for you all?
It says loading. There it is.
Oh, there. Okay. Let me apologize. It's not picking up in the right spot, but I'll get started as I pull it up. Like Dr. Bloom said, cases have continued to decline statewide, and we're at an all-time low in Lake County from what we've seen over the last year. And let me try one more time to get these slides up so you can see them. Okay, there we go. So on the left, we're looking at testing statewide. Testing statewide has decreased over the last couple months that we've discussed previously, and it plateaued for a couple weeks But in the last week, we did see it continue to decline at the state level and in Lake County as well. The great news is that we continue to see very low and declining testing positivity at 1.5% statewide. That's a 7-day average. That's the lowest that we've ever seen or reported. This is great news. Obviously, testing is down, but as long as this continues to stay down, that's a good indicator. Obviously, the number of new cases identified is low, about 2,700 new cases or 2,600 new cases identified yesterday. The daily case rate that the state is reporting as of yesterday was 4.7 cases per 100,000, the lowest that it has been in a very long time. And sadly, we are approaching 60,000 confirmed COVID deaths in the state of California since the beginning of the pandemic. Like Dr. Bloom said, it was a week ago, just after the Board of Supervisors meeting, that the state announced that it had reached its goal of administering 4 million doses in the Healthy Places Index Quartile 1, or in communities with some of the least healthy community conditions. So that goal was reached a week ago, and so the new thresholds for the daily case rates, which inform our tier, took effect. And I'll show those to you, but I wanted to highlight progress throughout the state in vaccinating people in the 4 different HPI quartiles that you'll see in HPI 1 here. Nearly 40% of eligible people, who are people 16 years of age or older, have received at least 1 dose. And about 58% of people here in HPI 4 have received at least 1 dose. So we'll continue to track this and report this over time to see progress in all our different communities statewide. Here are the new thresholds because the state has reached its goal, 4 million doses. Essentially, where it really has impact is that previously this moderate tier, or the orange tier, previously was 2.0 to 3.9 daily new cases per 100,000. And now that we have more people protected through the vaccine, they've increased this to 5.9 to move into the orange tier. And in Lake County, that means we can't have more than 27 cases in a given week. So like Dr. Bloom said, we expect, due to improving metrics, and I'm providing the latest metrics here for the week of March 28th to April 3rd, we expect the state to announce around noon today that Lake County will be moving into the orange tier effective tomorrow at 12:01 a.m. tomorrow. And we expect this map, which is from last week, to see more orange counties and maybe a few more counties in the yellow, indicating minimal transmission. So really positive news statewide. I'm really pleased to see that improvement hasn't just been in certain regions or certain counties, but we're seeing improvements in nearly all counties and certainly all regions throughout the state. So just going to say that again, we expect the state announcement to be around noon today, to be effectively in the orange tier tomorrow. And here's the epi curve, and here where we can show you the 3 weeks here that we had been in the red tier. The week of March 28th, right here, is what makes up our tier metrics that will be announced today. We identified 21 cases during this week, which puts us solidly with orange tier metrics. And then for the week that just finished, the week of April 4th, so looking ahead, this week we've identified 14 new cases for this week. Now, data will still come in over this week as we get test results back, but this is a promising sign that hopefully we see that this is pretty stable when we report this week. Next week, I'm hoping that it won't be more than 20 to 25 cases in this week to keep us solidly in the orange tier. Lastly, just a couple slides on really great progress in terms of vaccination coverage in the county. So about 43% of Lake County residents 16 years of age and older are at least partially vaccinated, and that's more than 22,000 people in Lake County. So I think that's really impressive. More than 22,000 people have received at least one dose as of yesterday. And I want to walk through the table because this is how I'm going to continue to report these data, because I don't believe that our tribal health data will be integrated into the California Immunization Registry. We were sort of hoping that would happen, and my sense right now is that's not going to happen. So I'm going to report them separately and show them here. So the limitation here is that the data aren't in all one system, so I can't pull them all at one time. So I'm using a number based on a older report from Tribal Health here. So this is actually a conservative number from Tribal Health. I actually believe that they've vaccinated more than the number I'm reporting here. And we'll continue to get updates so we can include those data in to help us understand total vaccination coverage in the county. So just to walk through this, from the California Immunization Registry, we know that about 6,700 people in Lake County are partially vaccinated, and that's about 13% of the eligible population. From the California Immunization Registry, or CARE, we know that about over 14,000 people, or almost 27%, more than 1 in 4 people in Lake County are fully vaccinated. And through Tribal Health, again, I believe this is a really conservative estimate, but at least 1,600 people are fully vaccinated for about 3.1%. So county-wide, over 22,000 people have had at least one dose for about 43% of the eligible population. And so then I was looking by age, and obviously there's been changes in who's eligible and availability over the last couple weeks. I was really pleased to see that just in the last 7 days, more than 1,000 people, 55 to 64 years of age, received their first dose. So this was a 30% increase from the week prior. And among younger people, 20 to 54, saw a higher percent increase as it's become more accessible and as they become eligible for the vaccine. So I think this is promising news that our younger age groups are interested in getting the vaccine and have shown up in the last week to do so. To focus on some of the older people in the county, I'm also pleased to highlight that 2 out of 3 people 65 years of age or older are at least partially vaccinated. And of course, this is important because age is a risk factor for severe illness, hospitalization, and death. So continue, though the progress is slowing, certainly among older people, continue to see slight improvements among some of our most vulnerable residents. And that's all that I have for today, and I'm happy to take any questions if there are any.
Thank you very much. Do we have any questions for Sarah? Dr. Bloom, did you want to go ahead and close up the presentation, or how would you like to proceed?
Absolutely. Unless there are any further questions for Sarah?
No, the numbers look great.
Yeah. So, as just to reiterate what Sarah was saying, our cases, very, very happy and excited to see that our cases continue on this downward trajectory, which at least over the past couple of weeks have remained stable and actually are at their lowest point that we've reported. So great progress, and hopefully this will continue. And again, we have not seen any significant number of breakthrough cases, meaning cases in the vaccinated population. And certainly we're going to be keeping tabs on that, but as of this point, we have not seen that. As far as the tier status, as Sarah mentioned, that we fully expect to be moving to orange tomorrow. And there's an exhaustive list of the various changes from red to orange that we'll be seeing when it comes down to rules and regulations. However, I wouldn't expect it to be as stark as it was from purple to red, but still, just to give you an idea of some of the changes, restaurants will be able to move from 25% to 50% capacity. All retail will be able to be open indoors with modifications without a maximum capacity as they had in the red tier. Wineries will be able to be open to 25% of maximum capacity without reservations needed. Bars can be open outdoors with modifications, and gyms and fitness centers can increase to 25% of maximum capacity, up from the 10% that they were in the red tier. Outdoor gatherings have increased in the maximum number of people allowed from 25 to 50. And although indoor gatherings are still discouraged, and certainly if that's to take place, masks should still be worn, as there's still a high percentage of the population that is not vaccinated. But the number has increased to be allowed to 25 people or 25% capacity if you're in a capacity limited environment. Also of note, for private events, which are conferences and receptions and meetings and other events that are ticketed, and there is a controlled entry, up to 100 people will be allowed at these events, up from 50 in the red tier. And if the attendees are vaccinated, then this will be allowed up to 300 people in the event. So just as a taste of the changes that we'll be seeing, for more information and a more exhaustive list, you can always go to the website covid19.ca.gov for more information. So just to talk a little bit more about the vaccine rollout, as Sarah mentioned, with the younger populations, that there does seem to be some ongoing interest, which is very good, from the younger populations in becoming vaccinated. And interest is, over the past 2 weeks, I know it was discussed before, that interest may have been waning a little bit, and for the first time, we had a vaccine surplus, which we still have. However, this past week, interest seemed to increase actually a little bit with the numbers that we were seeing signed up for vaccination clinics over the past week. Vaccine hesitancy is still an issue which we are working on, both with our partners throughout the county and with various programs ourselves. However, looking at what the vaccine numbers were last week, there were about 1,200 vaccinated yesterday in Lakeport, and we plan to be vaccinating around 500 to 600 a day at the Clear Lake sites this coming week. The big news is that April 15th, My Turn, which is a scheduling application from the state, will be opening to all residents 16 plus years of age for eligible vaccination. We have, as a county, already been performing vaccinations for those under 50 years of age, but it was quite a bit of extra work as we had to obtain those appointments through the Mohawk number or through the website, and it required a lot of extra manpower and clerical work. And so this April 15th date that My Turn will actually be opening to all residents 16 years of age and over will be significant for us, as it will allow us to properly and most efficiently place these patients residents into vaccination slots. And finally, I just wanted to briefly mention a couple of issues that we had this past week. I did want to mention one particular issue that occurred. As you remember, we were provided a number of staff from the state a couple of weeks ago, which was quite a boon for us as we were able to give a break to the hardworking staff that had been working all year long with not much break, and we're able to allow them to return to their regular job positions and to start to try to catch up on everything that they had to drop to help with the vaccination effort. But unfortunately, due to an unforeseen incident this past week, those state staffing members were rescinded, and that led to an unfortunate staffing scenario for us. However, as we had prior to obtaining the state staffing members, we were running our vaccination clinics, and we were able to continue our vaccination efforts. As we did prior to the state staff, we will continue to do so and have been doing so over the past week. So for the short term, we are utilizing the staffing model that was previously used prior to the state assistance in staffing. And for the medium to long term, we are currently working towards creating a blended model of staffing utilizing local and state resources to adequately serve the needs of the county. As far as long term, we're still moving towards the long-term plan of slowly shifting the majority of the vaccination burden away from the Department of Public Health and towards the other health services entities within the county, such as Adventist Health, Sutter Health, the primary care physician's office, and pharmacies. So in conclusion, our cases continue to decrease and have stabilized over the past couple of weeks, which has led us as a county to be able to move into a less restrictive tier from red to orange. And our vaccination rates continue to increase, as Sarah said, with about 43% of the county at least being partially vaccinated, and a much higher rate of vaccination in our advanced age vulnerable population. The vaccination interest seems to be increasing slightly, but vaccine hesitancy is still a major issue, and we're still working to reduce that hesitancy. Vaccine access has been increasing significantly and will be increasing significantly in just a couple days on the 15th of April, with My Turn opening to all of the residents over 16 plus in Lake County. And hopefully this will lead to even greater vaccination demand, as we do have a surplus and would like to use as much of that vaccine as possible. So please go to My Turn starting on the 15th. And if you have not had a vaccine, please sign up to be vaccinated, as it is the best protection against COVID-19 that we can provide our county residents. Finally, staffing the vaccination sites has had a few bumps in the road this past week, but we are working toward a sustainable mixed model of local and state resources for sustainable future operations. And with that, I will stop talking and complete the report and open to any questions. Thank you.
Thank you very much, Dr. Bloom, for your presentation, and to Sarah as well. Everything is looking very positive. This is good. Let's go ahead and open it up to board members. If you have any questions for Dr. Bloom, Supervisor Scott?
I do have a question. Thank you, Dr. Bloom, for your report. It's really looking, as Supervisor Sabatier is saying, very promising for Lake County. I do have a question, and I don't know if you'll be able to answer this, but I know the CDC this morning came down wanting us to halt Johnson & Johnson vaccines, and I believe we were offering one of those clinics this week. So what is the plan for that? Do we know?
So I was actually just in discussion just before the meeting this morning with our lead nurse. I'm still in discussion with our lead nurse, and I can get back to you about that. But I believe that we are looking at suspending just momentarily the Johnson & Johnson a vaccine in light of the new questionable findings pending further guidance from the state. However, I'm more than happy to get back to you with that, as I don't have all the information as just yet, as I was just discussing it this morning prior to the meeting.
Thank you.
And it looks like Denise Pomeroy's hand went up, and so I'm guessing it has to do with this comment and this question. So Jake, if we can ensure that Denise Pomeroy, Director Pomeroy, has the ability to unmute.
Hi, good morning, supervisors. Yeah, I just got a text message from our director of nursing. They were on a call with the state this morning, the IZ branch. They are halting the Johnson & Johnson temporarily. The clients the residents that have vaccines scheduled for tomorrow will be called today and offered the other vaccinations that we have, either Moderna or Pfizer. If they're willing to take those, they will still be able to keep their appointment. Anybody else will be rescheduled for another time.
Thank you very much for that update. Any further questions or comments? I think I saw Supervisor Pyska's hand up.
Well, thanks for clarifying that. I actually have my Johnson & Johnson appointment for tomorrow, so I was wondering how that was going to work with scheduling, but it's great news that we have a surplus to handle those appointments.
Yeah.
And after reading the press release on Friday, I went onto My Turn, and it was opened up to myself. I'm 45, so I think that for our county, anybody should try to get an appointment as soon as they can. And I really encourage everybody to do that. It's wonderful news to see that we have such an increase in demand, and that that our numbers for infections are low. So I'm really, really pleased to see that we're at this space, and encourage everybody to just try right now. I tried every day last week. I've been really, I've been waiting my turn, but when the opportunity comes, act on it, please. Thanks.
Thank you. Any further comments, Supervisor Scott?
Just want to comment on that. Last week I was actually in the pharmacy, and a woman there in line made a comment about not understanding how to get the vaccine, where to go. And I was impressed with our community. It wasn't only me, but there was 2 other people giving instructions and direction on how to get the vaccine. So it was really encouraging that our community is reaching out and making sure that people have the proper information. So just thank our community and keep up the good work on trying to help everybody get vaccinated.
Thank you very much. Any further comments or questions? I did have, number one, I want to provide some gratitude. I know that the staff shortage was unexpected, and I want to share appreciation for the over the weekend work that certain staff members provided to try and resolve the issue. And there is a solution at hand. It's maybe not the easy solution, but the fact is the service of providing vaccines is too important to decrease that service. And so I know that there are some future calls coming up to try and get back on board with the state and make everything the same as it was, because our staff need that respite. They need to be able to go home and relax and enjoy themselves. They've been working hard throughout this whole process. And so I appreciate the fact that there was work done over the weekend to fix those things. I don't want that to go unacknowledged. Very happy that we're going in orange. However, I don't see any updates, and I haven't heard through my CSAT calls of any updates either of any loosening up for getting into yellow. Yellow is still the same threshold in order to get there, but I also know that June 15th is still the potential date when the tier system might disappear altogether. Just wondering if you've heard anything about that, Dr. Bloom, about loosening up the restrictions after we hit that 4 million mark. Is there going to be a 6 million mark or an 8 million mark, something of the kind?
So I am not aware of the any sort of loosening of other type of restrictions based on volume of vaccination to HSI tiers. However, of course, I could be mistaking, and I could have missed a call. So let me just quickly ask Sarah. Sarah, have you heard of anything that I'm not aware of?
No, I think that's accurate what you both shared. I haven't heard of any changes regarding, or any changes we should expect regarding the yellow tier. Echo what you said about June 15th, being the plan at this moment, given the positive trends. The only thing that I'll say that it's not official yet, there has been some preliminary discussion about the rules essentially to move back into, so if we start to see an increase in cases and we would potentially have to move back into a more restrictive tier, they're actually making that, it's going to be harder to move back into, say, the red or the purple as we get more people vaccinated. So I think, so I haven't seen a change to yellow, but on the other end, I think they're making it more challenging that I expect will hopefully be able to stay in the orange tier. We would need an increasing daily case rate and increasing test positivity that would be fairly dramatic to move us back. So it could still happen, but they're tightening that up. Again, not official, but that's being looked at as more people and counties become vaccinated. And just one last thing I'll say there, again, not official, they are looking at perhaps setting thresholds for vaccination coverage to inform the tiers. So again, higher vaccination coverage, more easier to stay in a less restrictive tier. But to your point, just in 2 months, they are expecting to do away with the blueprint. So we may only be discussing this for the next 2 months.
Perfect. Thank you very much to the both of you. I think that I personally, on my CSAT calls, will be requesting a loosening of the yellow just because it's been, our businesses have been holding and waiting for a long time, and if our vaccination rates keep increasing, I see that as a safety net, and so far we have not seen the loosening of the restrictions backfire and show that it's put us back into a position of rising cases or rising positivity rates. So I think that we can continue following that method and try to open up a little bit more before June 15th if possible. It would be nice to be in the yellow and be nice to be done with it all too. And those are all the questions that I have. Let me just check again real quick. Any further questions? All right, let's go ahead and open up to the public. We have a public member here in the chamber that has a question. Please come up to the microphone and ask your question. And then just to prepare for the rest, in the Zoom room, go ahead and click the raise hand or *9 if you're on the phone, and we will get to you once we're done here in the chamber.
John Moss. I want to commend Dr. Pace last week for mentioning vaccine hesitancy. I want to commend you, Doctor, for mentioning vaccine hesitancy. And I am concerned about the Johnson & Johnson vaccine. And I would like to repeat what's happening to the Johnson & Johnson vaccine in Lake County, whether it's being taken back. Thank you. Johnson & Johnson were convicted of talcum powder being contaminated, and I'd like to know what the Johnson & Johnson vaccine was contaminated with this time. Thank you. I think both sides need to be looked at, and that's the way we can solve the problem and remain unified. Thank you.
And Dr. Bloom, would you like to provide a response to that?
Sure. Thank you very much for your comment. It's very much appreciated. So in response to your question, it is, as far as I know, there hasn't been any discussion of a contamination to this point. However, what the discussion has been regarding the Johnson & Johnson vaccine is that there were 6 cases of blood clots that were questioned to be associated possibly with the vaccine. And when any question like this arises, then the next question is, well, does the vaccine administration need to be halted until this is looked into a bit further to see if there actually is a causation as opposed to an association, or whether that association is actually significant. considering the number of doses of this particular type of vaccine having been given, and the number of questionable associated events that have occurred, it is still very, very rare, as they are looking at this point at only 6 particular events. And out of all of the vaccinations being given throughout the country, the Johnson & Johnson is actually a very small number of those overall vaccinations that have been given, as the great majority of them have been Pfizer or Moderna. So in deference, certainly to safety, because that is the number one concern when it comes to administration of any type of medication, as the whole reason for the administration of a vaccine is so that the population can be safer, and we can all be safer from this particular virus. So when the concern comes down to whether or not there could be anything having to do with the safety of the vaccine, then the vaccine administration is generally halted until more information can be gathered and analyzed, which is where we are at this moment. So again, just want to repeat that it is a small number, very small number of what is I'm being told and have read about is blood clots that may possibly be associated, but there's not enough data at this time to say whether or not there is a causal effect, meaning that 1, the vaccine caused the blood clots, and 2, whether or not an association even actually exists. So that's where we're at the moment. Hopefully that answers your question.
Thank you very much, Dr. Bloom. Yes, I think we've all been reading about it as of this morning, and I believe that the denominator was in the 4 million mark for the number of Johnson & Johnson vaccines, which makes 6 a very small number, but they're being cautious and they're reviewing it. And so right now we are on hold here in Lake County with the Johnson & Johnson. As was discussed earlier, we will be calling everybody who is has made an appointment for the Johnson & Johnson on Wednesday to see if they're willing to move on over to the other vaccines that are available to them, as we put that on hold until further notice. Okay, and I see we have 2 hands up in the Zoom room. And so let me find those hands. Elaine Zacher? No, sorry. Yes, Elaine Zacher. Let's go ahead and unmute. And please provide your full name.
Unmute. I'm Elaine Zacher, and I'd just like to say that I'm surprised that you're promoting the vaccine so strongly while the clinical trials are still ongoing, and there have been many adverse reactions, which are tracked by the Department of Health and Human Services at their website. You can find them at their website that's set up for this purpose. It's vaers.hhs.gov. And there you'll find a long list of adverse reactions, including death. These are the short-term reactions. Long-term reactions are unknown at this time. I think it would be better use of taxpayer dollars to spend them on health education. For example, clinical trials show that there is a direct correlation between levels of vitamin D and the severity of COVID symptoms. It's also known that UV light kills viruses and that viruses cannot live in fresh air. So people should be encouraged to get out in the sunlight and fresh air. And it's also known that there are effective medications against COVID. And you can check out this information on PubMed, which is a huge database, medical database, very comprehensive, includes the world's literature. You can search it by keyword. I can search it by keyword from my home. So I would encourage you to do more health education and be aware of the dangers of these vaccines. The long-term dangers will probably not be known until next flu season when people are low in vitamin D. And maybe I'd like to relay something my dentist told me. My dentist told me that now his patients have a lot more cavities, and that his patients who have never had cavities have cavities now because they're mouth breathing under the mask, and they're breathing in trapped bacteria, and it's deteriorating their mouths. And I imagine they're breathing it into their lungs, and it's having an adverse effect on their lungs. So people need to be educated about the problems with masks and to wear the proper kind of mask and not to mouth breathe under their mask. But that's all I have to say. Thank you.
Thank you for your comments. Next, we have Will Tuttle. Let's go ahead and unmute Will Tuttle.
Hello, hi. Yeah, this is Dr. Will Tuttle. I live in Hidden Valley Lake. And I sent an email to everybody, all the board members, urging you respectfully to consider adding Lake County to the Healthy Communities resolution, which has been already passed by 14 counties in the state of California: Yuba, Colusa, Butte, Del Norte, Glen, Modoc, San Luis Obispo, Orange, Shasta, El Dorado, Lassen, Placer, Siskiyou, and Center counties have already passed this, and it basically frees the counties from being under this California state colors and the different levels, orange and so forth. And the idea is that the counties themselves have enough wisdom and don't have to cater to and kowtow to whatever Sacramento tells us we have to do. It's really well known that California has probably among the most draconian, devastating economic lockdowns that are destroying people's health and economic health and breaking up families and just totally destructive to our society, and among the worst health outcomes. I mean, we have we have a higher rate. I mean, it's ridiculous that we are actually feeling like we have to abide by these technocratic rules that are being handed down by these bureaucrats. And the other thing is that I really like Elaine Zacher was saying. I really like what she was saying. She was saying that it's important. You are the representatives of us, of the people, and it's very important that you get educated. And the mass media has been censoring on a massive scale other viewpoints. There's over 32,000 doctors and health professionals, for example, that have signed the Great Barrington Declaration, saying that the approach that's being used of lockdowns and masks and so forth, and now of vaccines, is counterproductive. And as I said last time, I want to repeat this. This is very important. Mike Yeadon, who's he knows more probably than almost anyone in the world about vaccines. He's the former chief science officer of Pfizer. For 20 years, he was a top person in Pfizer. Pfizer's making the vaccine that most people are taking. He has resigned from there, and he is trying to warn the world about this vaccine. You have to understand, this vaccine has not been approved by the FDA, right? You know that. It has not been approved by the FDA. This vaccine has only been granted authorization for emergency use. Okay, it's never been tested. They've tried for 30 years to make coronavirus vaccines on animals. It always killed the animals. It always looked great in the beginning. They made the proteins that made the antigens and all that stuff.
And Dr. Tuttle, your time is up.
Died. They were all killed. And so what Mike Yeadon is saying very clearly here, he said, it is now too late to save any person who has been injected with any COVID-19 vaccine. He urges those who have not yet been injected with a deadly compound to fight for the continuation of humans.
Dr. Tuttle, if you could please get to your final point. You've passed your 3 minutes.
Okay, thanks. So the point is, this guy knows that Pfizer and these other companies are criminal. They've been fined millions of dollars for criminal behavior over the years. Why are we trusting them? He says billions are already condemned to certain unchangeable and agonizing deaths. Each person who has received the injection will certainly die prematurely And 3 years is a generous estimate for how long they can expect to remain alive. These are not safe and effective vaccines, and they will be killing people, and you're responsible if you're promoting this. That's really an important thing, essential. This is critical. This is a genocide. We really have to understand that.
And Dr.
we're
Tuttle,
being
I
blind.
need you
I'll stop. Thank you very much.
close up.
Thank you.
Thank you. Everybody's getting the same amount of time. We're trying to do the best we can to be fair. I see we have Kay Toy, if we can unmute, and then provide your full name, please.
Hi, this is Kathy Toy. Yeah, I really want to, at this point, just as a community member, lend my support for both vaccination and the continued use of masks. I don't recall the gal's name who was talking about checking in with her dentist and him telling her that mouth breathing, quote unquote, under the mask was causing cavities. I would ask people to consider the hundreds of thousands of healthcare workers that for decades have always worn masks in their field of work. It's something that medicine has been doing for a long time. So I would consider that's the truth of that statement. And I just would like to be in support of being community-oriented as opposed to self-oriented. And that's just what I want to say. We need to work as a community to create immunity and to move forward so that we can get on with our lives. Thanks.
Thank you. Next, if we can unmute Melissa Fulton. And even though I did provide your full name, if you can provide your full name.
Yes, of course. Melissa Fulton, CEO of the Lake County Chamber of Commerce. I'd like to go back to the comment. I was making some notes about the changes from red to orange. And in particular, as far as events, public events, with, I believe the statement was controlled numbers of people. And if the statement had to do with it's 100 or you can do 300 if they are vaccinated. So that puts anyone who wants to do an event, this is a question, in the position of having an entrance gate and asking people if they've been vaccinated. Is that a correct understanding in order to move from 100 attending to the 300 period, or the 300 limit?
I believe, and I'll let Dr. Bloom correct me if I'm wrong, that this had to do with conferences and through invites rather than just public venues and public events. But I'll let Dr. Bloom say the final word on that.
As far as I understand it, and again, I'm going to defer to the state document on this, as it's a bit more in detail. But as just mentioned, to my understanding, that this is in regards to specific invited guests. So that would be meetings, for example, or conferences where there is a controlled invite list, and that it's not an open to the public event or any other open to the general public scenario. As far as the proof of vaccination, that statement, again, I will have to defer to the state guidance, which should be able to be found at covid19.ca.gov, and also through the CDPH, the California Department of Public Health, as, excuse me, I don't want to make an incorrect statement regarding what that statement means, meaning whether or not that is just checking at the gate and what that checking entails, or whether that means a more advanced and robust confirmation of vaccine status.
All right, I appreciate that response. And that was the one point I missed, the fact that this is an invitation-only type of event. So I think what the real message here is that any of us who are planning outside public events need to check at the official website for clarification at the level we're going into. Would that be a correct statement? All right. Thank you very much for your time. I certainly appreciate all of the information that is shared on our Lake County position for COVID-19 each and every week. So my appreciation to our public health department and to the supervisors for making sure that we have this opportunity to hear for ourselves and also ask the questions. So thank you again.
Thank you. And I see no more hands up in the Zoom room, and I see no further hands up in the board chambers. Let's go ahead and bring it back then to the board members. Any further comments or questions before we finalize this item? All right, Dr. Bloom, Sarah, thank you very much for your report. Let's hope we keep moving forward and progress.